Board. Chief Bill, it's good to have you back before the committee. Next, we have the Honorable Rodney Butler. He is the board president for the Native American Financial Officers Association. Welcome, good to see you. And on the education front, we have Mr. Kerry Bird, who is the board president for the National Indian Education Association, also meeting here in Washington, D.C. this week. And then virtually, as Vice Chair Schatz has mentioned, we have Mr. Kuhio Lewis, who is the Chief Executive Officer, Council for Native Hawaiian Advancement. So you know, gentlemen, we have your full testimony as part of our committee record already. It will be included as part of that. So we would encourage you to try to keep your comments to about 5 minutes so that we have more opportunities for questions after you have given us your statements. So we will go in the order of introduction, beginning with President Makarov.
Thank you, Chairman Kowski and Vice Chairman Schatz, for allowing me to testify to this committee on Indian Country's priorities for the 119th Congress. My name is Mark Makarov. I'm the tribal chairman for the Pechanga Band of Indians in California. But today I come before you as the current president of the National Congress of American Indians, founded in 1944. NCAI is the oldest, largest, and most representative Indian and Alaska Native organization serving the broad interest of Indian country and tribal governments and their communities. Tribal nations are inherently sovereign governments with unique legal and political status. This has been long recognized by Congress and reaffirmed by the United States Supreme Court. Congress and the administration must continue to recognize tribal nations as sovereign governments and support clear directives that reinforce the legal and political status of tribal nations. Federal funding programs that deliver services and facilitate the sovereignty of self-determination of tribal nations are created by federal laws and policies that reinforce the obligation of the federal government to fulfill its trust and treaty obligations to support tribal nations and their citizens and their institutions. When Congress is acting under its unique obligation toward tribal nations and their citizens, they have the legal status as a political class rather than as a suspect racial class under the principles of constitutional legal analysis. The U.S. Supreme Court has consistently recognized and upheld the distinct legal and political status of tribal nations and their citizens. The Department of Interior and Secretarial Order 3416, directing its agency on implementation of administration priorities, recognized that the statutory authorities and treaty and trust obligations of the Department, that is Interior, to tribal nations are legal requirements that must not be impaired. So we ask that Congress and the administration ensure federal funding for tribal programs is not paused, reallocated, reclassified, or deprioritized when implementing any executive order or other administration priority. Ensure that in limiting the federal workforce, sufficient federal employees are available to deliver on all the trust and treaty obligations. Tribal nations support this administration's efforts to alleviate burdensome regulations and other barriers that hinder tribal self-governance and economic development, but these efforts must be developed in close consultation at all levels of government with tribal nations to ensure there are no unintended consequences. Now to staffing levels and vacancies at IHS. Chronic Indian healthcare workforce shortages have continued to plague tribal citizens and tribal communities. Finding and keeping qualified healthcare professionals in tribal hospitals, clinics, and facilities have been challenging due to current funding levels and location, primarily rural areas. The recent U.S. Office, I'll just say OPM, the recent email from OPM to approximately 2 million federal employees has caused confusion and concern among many, including those who tirelessly serve in Indian country. Among those federal employees are healthcare professionals within the Indian Health Service. This action has immediate consequences for tribal citizens and tribal communities that receive life-saving services through the IHS. Reduction to an already short-staffed healthcare provider does not honor the legal and political obligations made to tribal nations and puts lives at risk. We thank Congress for its recent steps to strengthen its treaty and trust obligations through its continued support of IHS advance appropriations. However, reducing healthcare professionals that serve our citizens and communities is a step in the wrong direction. H.R. 741, the Stronger Engagement for Indian Health Needs Act of 2025, is a step in the right direction, and we urge your support for this legislation. Now, the federal government has a fundamental duty to ensure public safety on tribal lands rooted in treaty and trust obligations to tribal nations. This obligation has been recognized by Congress, notably in the Tribal Law and Order Act, which underscores the federal responsibility to prevent crime in Indian country. The BIA Office of Justice Services 2021 report to Congress highlights a critical funding crisis, revealing that public safety and justice in Indian country is currently funded at only 12% of actual need. The funding shortfall is $3 billion. And it indicates a need for approximately 25,000 additional personnel to ensure adequate safety and justice services in tribal communities. The federal standard for officers is 2.4 per 1,000 people. Using the Oglala Sioux tribe as an example, at 0.6 officers per 1,000 people and 53,000 tribal members, there's a huge disparity. These disparities are common amongst especially large land-based tribes, and it cannot continue. To address these alarming unmet needs, Congress must commit to providing sufficient funding for public safety and justice programs in Indian country, ensuring safe and secure communities for tribal citizens. In closing, I'll close with jurisdiction. The public safety crisis in Indian country is deeply rooted in historical jurisdictional challenges stemming from regulations, statutes, and Supreme Court decisions over the past 150 years. This legal framework endangers lives by limiting the ability of tribal nations to effectively police and prosecute criminal activities, allowing dangerous individuals to evade justice. Congress must address and eliminate these barriers faced by tribal nation law enforcement and justice systems to empower them in safeguarding their communities. I am over time. I appreciate the consideration. And my last sentence is, we really need Nahasda. It's a shorthand on housing. Thank you.
Well summed up. Thank you, President Maccaro. Next, we will go to Chief William Smith. Chief Bill.
Chairwoman Mikowski, Ranking Member Solch, and the distinguished members of this committee, on behalf of the National Health Board and the 574 plus sovereign, federally recognized American Indian, Alaska Native tribal nations we serve, Awa'ata, thank you for the opportunity to provide testimony on the tribal health priorities of the 119th Congress. My name is William Smith. I am an EAC, and I'm a veteran of the United States Army. I serve as the Alaska Area Representative and the Chairman of the National Health Board. I also serve as the Chairman of the Alaska Native Health Board and Vice President of the Valdez Native Tribe of Alaska. The U.S. Constitution recognizes three sovereigns and federal governments, states, and Indian tribes. As sovereigns, tribes predate the United States and retain the rights of self-government. The Superior Court has upheld Indian-specific legislation determined that it is political in nature rather than based on an unconstitutional racial classification. Recent executive orders and guidance have unintentionally impacted the Indian health system. We commend the chairwoman on her letter to the administration urging the needs to meet the trust and treaty obligation of the federal government to tribes. We concur that the Department of Health and Human Services should issue a secretary order that acknowledges the political status of the tribal nations and their citizens. Plainly stated, the federal trust and treaty responsibility to tribes and exempt all tribal department programs from the impact of the recent executive orders and guidance. Further, we urge the committee and Congress to continue to educate the work with the new administration fulfilled its legal obligation to tribal nations. The Indian health system is continued to be dramatically underfunded. Providing Indian Health Service with full and mandatory funding will ensure the federal government is meeting its trust and treaty responsibilities and obligations to the tribal nations for health. The Indian Health Service National Tribal Budget Formulation Work Group estimated that full funding for the 2026 would be $63 billion. Congress further authorized the Indian health system to bill Medicare, Medicaid, and the Children's Health Insurance Program to address the funding needs. As Congress considers Medicare reform, it is essential that the federal trust responsibility for the Indian health care be honored at 100% FMAT for the services received through the Indian Health Service and expecting Indian Health Service American beneficiaries from the reforms, including work requirements, and consistent with the United States trust and legal responsibilities to tribes. Medicare reforms must be deliberate and understood that it impact Indian health programs, even though those changes do not immediately appear to do so. These resources are critical to address the need of Indian country, including behavioral health. The strain of the reliably available resources for Indian health system cannot meet the demand of the rising behavioral and health issues nationwide. Using the grants as the primary vessel to deliver behavioral health funding or any funding limited, travel provides its ability to deliver critical and services, reporting requirements, deterred patients from accessing care and lack of access culture compared to providing a treatment all components of behavioral health crisis in Indian country. We ask Congress to strengthen tribal behavioral health treatments and programs by increasing resources, providing the flexibility and self-governance of funding and supporting expanding access to tribal traditional healing services. Historical trauma compounded with social, economic, political, and environment factors have impacted the health status of American Indian, Alaska Natives, mothers, and infants. Further lack in the investment has resulted in the higher rate of maternal and infant mortality. Congress should support improving maternal and infant outcomes for Native mothers and children to provide the funding set aside in the Maternal Child Health Service block grants. Investing in a robust maternal and birth health workforce will improve data for the American Indians and Alaska and other mothers and infants. Many of these recommendations have been highlighted in two recent reports. The first, the Way Forward report by Alice Spotbear and Walter, Commission on Native Children, and the National Health Board Tribal Prenatal to 3 policy agenda. Congress should adopt the 2024 healthcare package introduced to the 118 Congress. This package includes a number of tribal priorities, included reauthorization of the special diabetes program for the Indians for 2 years for $200 million per year in Medicare, tribal flexibility. Indian Health Service provides scholarships and loan repayments opportunity incentive for the medical profession to work in Indian country. Any tax reforms legislation considered the 119 Congress should be making the Indian health scholarships and loan programs tax exemptable and be parallel with the other similar federal programs. Tribal sovereignty and excess of self-determined and self-government through the adoption of demonstrating pilot programs. We stand ready to work with this committee on this endeavor. In conclusion, the federal government made promises in the tribal treaties to provide for, among other things, health care of tribal citizens. These priorities are each a step to meet those promises and fulfill the trust and treaty responsibility. And I want to thank Awata, this committee, for the opportunity to speak. And the bottom line is Congress has the ability to look at the broken promises and seeing how every treaty was broken. And they have an obligation to fulfill those deals because, like one chief said, we have already paid. We have paid and paid and paid. We have paid with our land, we have paid with our lives, and we paid the deals. We have given up our lands and promised the United States said that they will take care of us, the health and the education. So, paid in full is what I'm looking for. Awata, thank you.
Thank you, Chief Smith. Welcome, Mr. Butler.
Wiki Suk Natampawak Natasui, Chairman Butler, Nute Mashantucket Pequot, Qua President of NAFOA. Good afternoon, my friends. My name is Chairman Butler, and I am from the Mashantucket Pequot tribe, and I'm also here as the President of NAFOA. Chair Murkowski, Vice Chair Schatz, and distinguished members of the Senate Committee on Indian Affairs, I thank you for the opportunity to testify today as the President of NAFOA, founded as the Native American Financial Officers Association, on our economic priorities for the 119th Congress. This hearing on the needs of tribal communities is crucial now, with a new administration, a new Congress, and new opportunities and challenges. For over 40 years, NAFOA has worked to grow tribal economies and strengthen tribal finance through advocacy, education, and policy development. Our member tribes and tribal enterprises represent the diversity of Indian country's economic landscape, including tribal gaming, energy projects, agricultural ventures, federal contracting, and many, many more. First, we will continue to emphasize that the relationship between the federal government of the United States and tribal nations is rooted in a political relationship between sovereigns, not a racial or any other classification. The Supreme Court unanimously confirmed this in Morton versus Mancari and has consistently upheld this tenet. This political relationship, recognized within the United States Constitution, forms the foundation for modernizing the federal treatment of tribal governments and their enterprises. The recent issuance of executive orders and subsequent funding pause raised significant concern among tribal nations. Tribes across the country reported challenges with access to critical systems, a lack of information from federal agencies, and considerable uncertainty about the potential impacts of such actions. Regardless of the percentage of total budget, a pause in federal funding, whether temporary, prolonged, or permanent, impacts the ability of tribes to offer crucial programs and services to our tribal citizens. And to this end, I want to thank you in particular, Chair Murkowski, for the letter that you sent to OMB recognizing our unique status and requesting a government-wide exemption that acknowledges that tribal nations must not be impacted by executive orders related to DEI. At NAFOA, we remain committed to monitoring the impacts of federal actions and helping other member tribes with tools and resources to navigate adverse federal policies. We urge Congress and the administration to ensure all tribal programs and federal serving tribal nations remain fully operational and adequately staffed. This includes recognition that program funding fulfills legal obligations, protection of funding streams supporting tribal economic development, and maintenance of federal staffing levels needed for program delivery. The continuation of vital technical assistance programs, preservation of agency expertise in tribal matters, and protection of tribal-specific program offices are essential for supporting tribal economic growth. It is important to mention that tribally owned entities under the umbrella of the tribal government are critical to create jobs and to supplement funding for tribal programs that are underfunded in the federal budget. In addition to protecting trust and treaty obligations, we urge Congress to address tribal tax parity legislation that was introduced by our good friend, Senator Cortez Masto, with tremendous bipartisan support. Over the past several Congresses, NAFOA has worked with both the Senate and the House on legislation to address long-standing disparities in the treatment of tribal governments and tax policy. Based on feedback from Congress and our tribes, we have made important revisions to our legislative proposals that we are confident will allow for inclusion of key provisions in the upcoming tax package that will be considered by Congress. Congress must address long-standing disparities between state and tribal governments and ensure that tribal governments are treated under the same provisions as states for key tax purposes, including excise taxes, bond issuance, pension plans, general welfare benefits, and charitable organizations. Unfortunately, in recent years, the disparity between states and tribes has only increased. According to the Brookings Institute from 2014 to 2020, state governments issued $47 billion annually in non-taxable municipal bonds compared to only $84 million by tribal governments. Finally, empowering tribal governments by providing them full parity with state and local governments and accessing tax-exempt bond financing will enhance job creation, generate sorely needed governmental revenue for social services, stimulate infrastructure and business development on tribal lands, and accelerate the diversification and resiliency of tribal economies, particularly in private sectors. Another critical provision in our legislative recommendation is the creation of the annual $175 million New Market Tax Credits for low-income tribal communities. The New Market Tax Credit Program attracts private capital to economically distressed communities by providing tax credits to investors. Unfortunately, tribes are too often unable to access these credits. Our recommendation is a set-aside for these credits for Indian country. Finally, we recommend that any tax legislation considered by Congress include tribal low-income housing tax credits. This program provides tax incentives for developers to create affordable housing, but credits are often unavailable to tribes. We recommend these and other tax priorities be included in the larger tax framework being considered by Congress this year. By modernizing the tax code's treatment of tribal governments and providing targeted economic development incentives, tribal tax legislation will help tribes generate governmental revenue and deliver essential services to build stronger reservation economies. We also urge Congress to make sure the Treasury Department's Office of Tribal and Native Affairs become permanent and continue the Tribal Treasury Advisory Committee. These entities are essential partners for tribal governments and their business entities. They allow for efficient and effective consultation, communication, and ensuring that tribes can access tax incentives and economic development tools. We also support the effort to reclassify both contract support costs for the Tribal 105L lease program to mandatory, which is consistent with the statutory language in court decisions. This reclassification will allow tribal governments to continue to exert tribal control over the provisions of programs within their communities and exercise self-determination over tribal government infrastructure. And lastly, NFOA encourages Congress to increase the amount available to tribes through the Department of Interior's Indian Loan Guarantee Program and authorizing language that will allow it to work with the new market tax credits. As currently written, tribes cannot take advantage of the new market tax credits if going through the Indian Guarantee Loan Program. This simple fix will have a significant impact on the ability of tribal nations to access capital. In closing, the federal government's trust and treaty response obligations must be upheld through concrete action to support tribal economic development and financial sovereignty. NFOA's recommendations represent an important step towards fulfilling these obligations and creating sustainable tribal economies that benefit both federal governments and tribal governments. I thank you again for your time today. Kapatuimu. Thank you all.
Thank you. We go to Mr. Kerry Bird.
Yes, Chairman. Chairman McCoskey, Vice Chair Schatz. Chairman Mikowski, Vice Chairman Schatz, esteemed members of the committee, good afternoon. My name is Curry Bird, and I'm president of the National Indian Education Association. I'm a citizen of the Sissidan-Wahpeton Oyate of South Dakota and a descendant of the Lumbee tribe of North Carolina. On behalf of the students, educators, and tribal nations NIA serves, I appreciate the opportunity to testify today on the critical issues surrounding the Native education and the federal government's trust and treaty obligations to American Indians, Alaska Natives, and Native Hawaiians. Sovereignty is the foundation of effective education in Indian country. The federal government's trust responsibility to Native education is a foundational obligation firmly established through treaties, laws, and legal precedents. But today, Native students in both BIE schools and public schools face chronic underfunding and deteriorating infrastructure. Worse yet, federal policies often fail to support the inherent sovereignty of tribal nations in managing their own educational systems, leaving communities stuck in a bureaucratic red tape. To address these issues, we urge Congress to take decisive action in 5 key areas. First and foremost, Congress must affirm the political status of Native students. The federal trust and treaty obligations, tribal nations for education, and the federal trust obligations to Native Hawaiian education are not discretionary commitments. They are legal obligations. This duty has been reaffirmed through centuries of legislation, beginning with the Civilization Fund Act of 1819, codified as federal directive in the Snyder Act, and later strengthened under the Indian Self-Determination and Education Assistance Act, as well as the Tribally Controlled Schools Act of 1988. The trust responsibility to individual Native students in public schools has also been reinforced through the Johnson-O'Malley Act of 1935, Title VI of the Elementary and Secondary Education Act of 1965, and the Native Hawaiian Education Act of 1988. Tribal nations and Native communities should be empowered to design educational systems that reflect their values, traditions, and economic priorities. These programs are not simply a matter of cultural pride, but also critical to the future and economic success of our communities. Second, we need stable and adequate funding. Our schools require consistent investment, not fluctuating annual budgets that create uncertainty. Advanced appropriations would ensure that Native education programs are shielded from budgetary disruptions, allowing for long-term planning and success. Additionally, Congress must protect Title VI, Johnson-O'Malley, and impact aid programs, ensuring Native students in public schools receive the resources
they are owed. Third, we must expand self-governance in education and empower tribal nations to control their education systems. Extending Public Law 477 and 638 across more federal programs would give tribes greater autonomy over education. Additionally, 105L lease funding should be moved to mandatory appropriations to ensure tribes can build, repair, and maintain schools independently while ensuring the federal government meets its fiduciary responsibilities. Fourth, early childhood education is a critical foundation for lifelong success. The Alice Spotted Bear Commission on Native Children has emphasized the urgent need for culturally relevant early childhood programs that address the unique needs of Native communities. The report highlighted the importance of improving access to Head Start and other early education services that are responsive to Native languages, culture, and values. Congress must prioritize implementing the Commission's recommendations, which are vital for providing Native children with crucial developmental and educational opportunities. Finally, I want to highlight the urgent need to improve BIE school facilities. Unlike DoD or Department of Defense schools, which receive significant investment, many BIE schools are operating in unsafe, outdated buildings. To ensure that Native students have safe learning environments, tribal nations must have access to consistent funding for construction and renovation, whether through direct appropriations, the Great American Outdoors Act, or expanded 105L lease agreements. Members of the committee, the stakes are high. By supporting Native education, you are not only investing in the future of our youth, but also strengthening the resilience and sovereignty of tribal nations and ultimately the success of the United States. I urge you to act now to uphold trust and treaty obligations and ensure that Native students receive the education they deserve. Thank you, and I look forward to your questions.
Thank you, Mr. Byrd. And now we go virtually to Hawaii. Mr. Lewis, welcome.
Aloha. Aloha, Chair Murkowski, and to our very own Senator and Vice Chair Schatz, as well as esteemed members of the committee. I'm Kuhio Lewis. I'm the Chief Executive Officer of the Council for Native Hawaiian Advancement. I want to extend deep mahalo to you, Chair Murkowski, for your steadfast support for our Native people across America. For background, our organization is actually the sister or the mirror to AFN, or the Alaska Federation of Natives. We gather a community, we identify priorities to them, and we elevate them. We have 1,600 members as part of our organization's network. We're a HUD-certified counseling agency. We are the largest Native CDFI in Hawaii, and we manage large-scale workforce programs, housing projects, financial aid, and we also help manage tourism in our islands. And currently, we're playing a pivotal role in helping Maui recover from the devastating wildfires. CNHA also operates a policy center, and we help connect people with decision makers. Just by way of our comments, the federal government has a special and political and trust relationship with the Native Hawaiian community following the overthrow of our queen and the annexation of the kingdom, the illegal annexation of our kingdom of Hawaii, and the seizure of our trust lands. These are the same trust principles that Congress has recognized and it owed to the Native people of the United States. And in lieu of a government-to-government relationship, the federal government fulfills this trust obligation to Native Hawaiians by working with Native Hawaiian organizations like ours and many others out there, as well as the Native Hawaiian community at large. Compared to other groups in Hawaii, Native Hawaiians face some of the greatest disparities. We have the shortest life expectancy. We're the most likely to live below the poverty line. We experience significantly higher rates of unemployment. We're the most incarcerated. And an unfortunate statistic is recently there are more Native Hawaiians now living outside of our homeland of Hawaii than in our homeland. We're losing more and more. We've already lost our monarchy, our lands, our culture, and now we're losing our people. The cost of living, the unaffordable housing prices, the lack of career opportunities have pushed our Native Hawaiian people out of their homeland. And while great strides has been made, more work needs to be done to support our Native people. The inclusion of Native Hawaiians in programs like the Office of Indian Energy, increased funding to support programs like Nahasda so we can build housing, ensuring that trust principles are met and Native Hawaiians can stay in their homelands is critical. These funding mechanisms allow us to leverage private funds as well so that we can further support our people. In closing, similar to what others have said, Nahasda funds are critical to our advancement, and there's been tremendous happenings ever in recent years with respect to Nahasda. So, as well as for our Native Hawaiian education funds, though it's helped to perpetuate and cultivate the continuation of our language, our Hawaiian language programs, which was something that was lost. And our Native Hawaiian that we get from Congress is also critical. So what we're asking for is for the continued recognition and support of our Native Hawaiian people in Hawaii, and we will do our part to continue to support our people. Thank you, Chair. Thank you, committee members, and I'm available for questions.
Mahalo, Mr. Lewis. Thank you. And thank you all for your comments this afternoon. We'll now turn to questions from the respective members of the committee. You have all reminded us of the trust responsibility that a federal government owes to our Native peoples, regardless of where you live. That trust responsibility is something that we hold, and it is with regards to economic opportunity, education, healthcare, housing, as we have heard here today. So when we think about the priorities going into this new Congress and areas that we can focus, I think you've given us a lot to consider. I want to start my questions here this afternoon directed to you, Chief Bill, on the health aspects of this responsibility. And you have mentioned in your comments the alarmingly high maternal mortality rates that we see for Indigenous women. I find the statistics just really shocking. Pregnancy-related deaths at a rate more than 3 times that of white women. American Indian, Alaska Native infants born prematurely, underweight, twice as likely to die before the age of 1. We know that some of these statistics are related to access to health care and to socioeconomic challenges. But you suggested in your comments that there's some recommendations that have been outlined in a couple different reports, one of which is the Native Children's Commission. This committee is going to be working to build that out. But can you expand a little bit more on any specific recommendations that you would like to see the committee address when it comes to maternal mortality and infant health?
Thank you for that question. I got 5 of them here. It says, protect tribal sovereignty and self-determination. Emphasize the importance of tribal nations' right to self-govern as a function of our health equity. We know how to take care of our own. We proved that in Alaska with COVID, when we took care of the whole village instead of just taking care of specific people. Invest in equity resources and funding. Advocate for significant investment in tribal community to improve outcomes for the children and the prenatal to age 3. And the other part of that program was address trauma and strengthen connections to culture. Focus on the healing from trauma and building resiliency through culture connections. And as you know, there's all kinds of trauma, starting with the boarding schools and even being isolated. You know, our little remote villages over there is far away from all kinds of supermarkets, playgrounds, and everything else that is needed to make sure that the kids can have a place to grow up after they do turn 3 and stuff. So enhance access to quality health services. Ensure that the Alaska Natives and American Indian families have access to competent, high-quality health services. And I put this to when I was born in Alaska and went to the Indian Health Services hospital on 4th Avenue, 4th and 3rd, I was scared to death to go there. This new hospital we got in Anchorage, the medical center, welcomes you and everything else, but it was like a death sentence going to that other one for the dentist work, and even as you were growing up as a kid. So I can just imagine. I never recognized the 1 through 3 because I don't remember that part, but Mom does. The support hostile and intergeneration approach, promote policies and consider the hostile and intergenerational needs from Alaska Native American Indians. And all these recommendations aim to create a path forward towards a healthy outcome for American Indians and Alaska Native infants, the toddlers, and for their mothers.
Well, and I think what we want to do here on the committee is look at the various reports that are out there. It's one thing to task a commission and have them put together a great report. It's another thing to actually have us implement on that, and I think we want to do that. I want to direct a couple of questions to you, Mr. Butler, with NFOA, and I appreciate that you've given us some concrete suggestions here to look at from the financing perspective: new market tax credits, tribal low income tax credits, focusing on the Indian Loan Guarantee Program, some real specifics here. You've also mentioned the priority of making Treasury's Office of Tribal and Native Affairs permanent and continuing the Tribal Treasury Advisory Committee. That's good to hear, because oftentimes we don't hear good reports coming out of some of these tribal liaison that we have established within agencies. But what you're telling me is that this is one where we're seeing good outcomes and it's working and it needs to be continued. Is that a fair summation?
Yeah, absolutely. Absolutely, Chair. And selfishly, one of the many hats that I wear is actually a member of the Treasury Tribal Advisory Committee as well. So I saw firsthand in a very short period of time how the impact of having tribal leaders engaging directly with leadership in a specific department, in this case Treasury, leads to great results. I mean, the rulings that were put out on GWE and wholly chartered corporations is monumental. And like for the tribally chartered corporations, that ruling was 30 years in the making, and having the Office of Native Affairs there, as well as the TTAC there, allowed us to progress that and constantly be in the ear of Treasury and IRS, working hand in hand collaboratively to solve those issues that tribes have been waiting on for decades, quite frankly. And so it's a great example of success in the Department of Treasury, and one that should be replicated in other departments as well.
Good, I appreciate that. Let's go to Vice Chair.
Thank you, Chair. Thank you, all of you, for your testimony. Mr. Lewis, thank you for your work. Can you help the committee to understand what are the barriers to success, any needed changes or improved flexibilities that could help the Council for Native Hawaiian Advancement to access more federal dollars?
Aloha, Senator. Thanks for the question. I think the immediate challenge is the uncertainty that currently exists. We have active grants and awards from the federal government, some which we can't even draw down on. And what that does is it creates a lot of instability in our organization, not knowing the future of some of the programs that we are actively implementing. So that's a current challenge for us, is just there's a lot of uncertainty. Also, our ability to plan going forward and how we can address some of the long-term needs of our people that we've been working towards for a while. I would say we, of course, are looking at how we can diversify ourselves, but the federal government has been an important part in how we develop programs and work collaboratively with the government to support the needs of our people.
Thank you. And just one thought for everybody watching. I understand the principle here that when you're dealing with Native peoples, you are dealing in treaty and trust and statutory responsibilities, and that you're not dealing with particular ethnic groups. And so the sort of dragnet of calling everything DEI should not apply. I get that. I agree with that. But we need a little solidarity too, all of us together, to say that if what someone is talking about when they say DEI is a consultant coming in and showing a PowerPoint and dividing up the workplace by race and developing quotas and refereeing the kinds of words that people are trying to use, that's one thing. But understand that when they say DEI, they are rolling back basic protections for women, for Native people, for Black people, for Asians, for Latinos, for immigrants. And so when these kids, frankly, go into agencies and literally control F to find words like gender or climate or equity or inclusion, they are sweeping up recruitment for the Navy. They are sweeping up recruitment for FBI officers. They are disallowing NIH research into pregnant women. And so I understand the need, if you are in charge of an organization, if you represent a tribal community, the need to just survive this moment. But we need to understand what's happening right now is unlawful. And it is not our job in a democracy to petition the king for mercy. It is our job in a democracy to stand up and say, this is impermissible under the law. Not, I know this is impermissible, but would you please make an exception for me? That was not a question. Mr. Byrd. Mr. Byrd, tell me about the impact that the executive order on school choice for BIE and tribally controlled BIE schools is impacting the work that you do and the organization that you oversee.
Sure. School choice, tribal nations believe in school choice in the local control of their schools. However, tribally controlled schools are our choice, and we feel that school students learn best when the tribe has control of those schools and are determining what's being taught. Because our curriculum includes tribal values from the community. They include the curriculum that's related to that particular tribe, as well as natives across in other tribal communities. We're concerned about the possibility that school choice model that relates to schools becoming under BIA control would take away funding from BIE controlled schools. So any school choice model for Native students must be made with tribal nations at the table, helping to assist in making those determinations. I know, looking at my father's tribe, the Sissinawapadan Oyate, they have a tribally controlled school. And Cheshpazina is located in an area very close to the heart of the tribe. It's close to the senior center. It's close to tribal administration. It's close to the powwow grounds. So it has all those components that make it more of a success because it's so centered in that community, and it has the parents' control, parents' involvement. It has the seniors' involvement. It has language providers in that school. So the curriculum is very much focused on the needs of the students in that school system. They wouldn't have that same opportunity at the public high school in Sisseton, where there are no or very limited Indian teachers in that community, in that school system. It wouldn't have the same types of encouragement or pride of being an Indian student in that community. So the school choice, being a tribally controlled school, is so important because of what it brings to the student and to the tribal member and the involvement of those within the community.
Thank you.
Thank you so much, Chair Murkowski, and thanks to all of you for being here. I want to just say, Vice Chair Schatz, I appreciate your comments, and I'm thinking about how earlier today I was addressing an issue with a Catholic university in Minneapolis that had a grant for to train special education teachers, frozen, because it was all caught up in this DEI nonsense. So that's going to hurt the ability of my state to respond to the deep shortage of special education teachers is going to hurt Native kids, it's going to hurt Black kids, it's going to hurt brown kids, it's going to hurt white kids. It hurts everybody. So I appreciate your comments. I want to touch on first something that I know is really important, and certainly in the tribal nations in Minnesota, and I believe around the country, which is the impact of this devastating opioid and fentanyl crisis. Certainly it's an issue all over the country, but I think that it is a particularly devastating impact on many tribal nations because of the ways in which tribal members are targeted for these crimes. And I see this as both a public health crisis and also as a public safety crisis. So President Maccaro, I'm going to ask you first about this. Last year, Senator Daines and I partnered to introduce a bill called the PROTECT Act, which would basically expand the special tribal criminal jurisdiction, which has been so successful with issues around trafficking, expand that special criminal jurisdiction to include drug crimes and gun crimes that are committed as part of drug crimes. This would get at the challenge that so many so many tribes have addressing when non-Native people come onto tribal land and commit drug and gun crimes. President Maccaro, could you just talk about this a bit and give me your perspective on whether something like this would address some of those jurisdictional challenges you were talking about in your testimony?
Thank you for the question. I appreciate the softball. Yeah, it's something, tribes need jurisdiction back. The ability to not only arrest, detain, but to prosecute those who commit crimes on our reservation lands and our reservation communities is going to be important to going forward to be able not only to stem the flow of drugs, but to create safe communities.
Right.
You know, the status quo right now that's really unacceptable is the circumstance where drug dealers, they know what the laws are. They know that they can't be prosecuted. They know they'll get away with the crime.
Creates this revolving door.
It is a revolving door. There's a circumstance where they'll come on. Maybe if the tribe is lucky enough to have a police force, that they'll get arrested, and they might even be detained for 72 hours. But then they have to be released at 72 hours and 1 minute. They take them to the county line, and I think if the tribal police are lucky, there'll be county police or county sheriffs to accept the criminals, but maybe not, and they just go away and come back within hours sometimes within a day, and do it all over again, and it doesn't end. It's a scourge, and the solution is ultimately the full fix for Oliphant. Okay. But, I know we're taking baby steps or incremental steps toward that, getting to that goal. But the sooner we get there, I think the better things will be in the long term. I think, let me just add this though, creating or if you were to wave a wand right now and Congress would, in a bipartisan fashion, create that kind of a jurisdictional fix, the condition of not having enough funding,
right.
Creating the fix without the funding is also not going to help.
Yep.
So both parts need to happen.
I appreciate that. I think that's a really, really great point. And it's a tool, but if you don't have the funding to use the tool, then the tool is not going to be that valuable. As I said, I see this as both, and I think all of us do see this as both a public health crisis as well as a public safety crisis. And so, Chair Smith, I want to ask you, in your testimony, you talked about the special diabetes program as a model for bringing both funding and autonomy to tribes so that tribal knowledge and medicine and healing can be brought together to solve issues around diabetes. The same model, I believe, could also be used really effectively to address behavioral health issues. I'm wondering if you could just comment on that. I'm really grateful to NIHB for your assistance in moving my Native Behavioral Health Access Improvement Act. That's a mouthful, but what it would do is to take that learning from the diabetes special program and apply it to behavioral health.
Thank you. Thank you for that question. And my answer would be to you is the education of our health workers so we can help the person that is stuck on these drugs to get them off and get them in a safe place. But that's not going to solve it till they do get tougher on the crimes and put the perpetrators away. To me, you might not like this, but I think they should take their own medicine. I know when I was growing up in Cordova, Alaska, in the old days, we had what you call a blue chip. When you wanted to blue chip somebody that was being not correct in your community, you just send them to Seattle, which means you put them back on the boat. But that just puts the problems in Seattle. The problem is the courts just let them get away with it.
That's why
And
you
we
have
need
to
to stop that.
yeah.
But on the health part of that, and that's the part that the National Health Board would be the health part, was the education and how to recover from a fentanyl overdose, because a lot of them don't. And a lot of them don't recover because once the brain gets scrambled, sometimes you just can't unscramble it. So preventive maintenance, education, everything else is what the health part of it is. The other part of it is like working with the National Congress of American Indians, where we can stress to be tougher on the criminals. Quit giving them the revolving door, quit letting them in and out, and know that they can get away with it. And even in my state of Alaska, they really happy they found a bunch of fentanyl coming into Alaska. How much didn't they find? How much come in that they didn't? Because it's coming in every which way. And we just need to figure out how to stop it. Enforcement. Education part is trying to educate the young ones to just stay away. And the ones that are hooked, how to get off. And the ones like grandmas and grandpas and parents, how to save that person's with Narcan or whatever it takes. So.
Thank you. I know I'm way over time. Thank you very much, Chair Murkowski. Thank you so much to all of you for your testimony.
Thank you, Senator Smith. Senator Cortez Masto.
Thank you, Madam Chair. And thank you all for being here and for the continued work on all of these issues that we are constantly trying to address here. And it almost feels like Groundhog Day because we're back saying the same things. But let me just say this. Because of, and I hope you take this away, because of your work and advocacy, there is legislation. And there's bipartisan legislation. This is going to be a priority for us in this Congress to get it passed, as you all know. And we're going to continue to need your advocacy. So I appreciate you being here because there are many of us working together to get it done. And let me start with this, the Badges Act. You know, my colleague, Senator Hoeven, and I have reintroduced that again, and it is so important for the very reasons, President Maccaro and everyone else that I'm hearing about the law enforcement piece and the underfunding of law enforcement in Indian country. I also know that for our BIA officers in Indian country, it is hard to not only recruit them, but retain them. That's part of the challenge that we have, and the Badges Act will work to address that. So it's good to see you again, President Maccaro, and thank you for your work on the Badges Act. But I do want to touch on one thing, because we always talk about BIA officers, we talk about law enforcement. We forget tribal courts. Tribal courts are just as important. And there are challenges in our tribal courts right now. And let me just give you an example. And this is what I hear in my state. Tribal courts and communities are often denied access to funding and law enforcement tools that their non-tribal counterparts regularly use. For example, I have introduced the Tribal Access to Electronic Evidence Act. This would give our tribal courts the same access as their non-tribal counterparts to electronic evidence for criminal investigations. It sounds so simple, but it is important for us to make sure that our tribal courts have access to all the information that our non-tribal courts do if we are going to hold these predators and people in our communities accountable. So, President Maccaro, let me ask you this. Can you talk a little bit about the importance of tribal courts in Indian country, but also as you talk about it, can you address the lack of resources for tribal courts and the impact to the public safety that provides if we don't have resources for tribal courts.
I wish we had enough time to go into
Yeah.
depth on that question. Can you focus it just a bit? Because, I mean, it is broad ranging, but
Well, let me ask you this, because at the end of the day, for our tribal courts, there's a lot of challenges there. But if we were to give forget the jurisdictional issues, because we need a challenge, we need to address those jurisdictional issues. But if we were to give tribal courts access to the same information, electronic information, access to maybe national, federal databases that non-tribal courts have, how would that improve public safety in tribal?
it would improve tremendously. I think there isn't necessarily a problem or an issue with tribal courts having capacity or competence or things like that. We know that from the daily work that tribal courts do throughout the country, throughout Indian country. I think there are problems, I think, with outside courts and entities having, I think the term is comity, right? Accepting as valid the work that tribal courts do. That attitude, I know, is still there. I know it's still there in Indian child welfare work, and so and also other subject matter arenas. So, if that goes, it feels like that would be helpful in moving the ball considerably. In the way that with law enforcement, having access to databases like for tribal law enforcement agencies, having access to NCIC for officers in the field that don't, and other databases like that, so that the quality of the work going on, for the people doing the actual work, meets those standards, and there's no question about it.
Yeah, and I appreciate it. And let me just highlight this, because it's just one piece of it, right? Well, you're always having to come to us to figure out even what crimes tribal courts can go after and hold people accountable for. This is crazy in the sense that if we're going to give and recognize that sovereignty and give tribal courts the authority that they need to go after and hold individuals accountable, we shouldn't hamstring them. And it's not just a lack of resources, it's actually some areas where you need access to information that you're not getting, that other courts are getting that are non-tribal.
Absolutely. So can I just add one more element to this? And one of the reasons why I said this goes a lot deeper, I think there's a missing infrastructure piece to the question you're asking, and it's that there's a lack of, I think, the infrastructure that's needed within the Department of Justice. There's no bona fide tribal desk. There's no place of a clearinghouse of all tribal issues, and there should be, and there needs to be. This is not to discount the tremendous work that those who are doing Native American work in the Department of Justice are doing, but there aren't enough. For instance, there aren't enough attorneys to handle tribal work within the Department of Justice. And so I think there needs to be ultimately some restructuring, so there can be a focus on this, and then all things tribal, all things Indian country could flow through that desk. And it right now, well, for a long time, it just has seemed to be more ad hoc than truly structural and grounded, and in all things tribal sovereignty.
Thank you. And I know I'm over my time. I want to thank you all again for your comments. President Butler, thank you. Thank you for highlighting the Tax Parity Act, the importance of it. That act and that legislation, again, was driven by all of you. What I was hearing, what we were hearing, the chairwoman is working with me on that as well. She understands the issues that are important. I think this is another opportunity for us to move the ball forward here and get something done. So thank you again for all of your advocacy.
Thank you, Senator Cortez Masto. A lot of good discussion here about everything from housing to how we can move out on economic development, obviously education, healthcare, drugs, public safety, all very key. When we think about tribal self-determination and what that really means, there's so many opportunities, I think, for us, particularly within 638 and compacting. There's a big efficiency effort going on by some folks outside this building. You may have noticed it. I can't think of a greater demonstration of empowerment of our tribes, of the people on the ground, than how we're able to build things out or facilitate efforts through compacting. 638 holds such promise for us. We've got a measure that I've talked a lot about when it comes to forest management. And when you think about those that are closest to the land, those that have a real appreciation of understanding when you have low rains and low snowpack, you're going to have greater propensity for fire. How do we handle this? How do we address it? Well, those that are literally on the ground, that are the stewards of these areas, know better than anyone else. So how we can really work to do more in this area is something I'm going to challenge us as a committee to work on. Mr. Byrd, I know that USDA is soliciting feedback from tribes right now regarding the child nutrition programs, the tribal pilot projects. I understand that there either was or there is a listening session later today at the NIEA conference to allow tribes and tribal organizations to administer nutrition programs, whether it's the school lunch program, the school breakfast program, summer food services, the child and adult care food program. Can you share with me how that's coming? Have we identified barriers to standing up some of these programs? I think about, for instance, specifically like the summer food programs, where you don't have the kids in the school necessarily; they're just kind of dispersed over. But how we can implement in a more efficient, a more effective way that gives the value, if you will, to the children in terms of nutritious opportunities for food during the summer or during the school year. We can do more on this. Right. Have we identified the barriers? What do we need to do?
It's not so much identifying the barrier. Well, it's about giving the tribes control of the whole institution. So they already have control of the school itself, but not the lunch component that's midday of the students' existence there at school. And I was talking to a tribal member back in Sisseton, and he said that one of the things they have is they have a bison herd, and their goal is, or they're planning to do, is process the meat. So they have a meat processing plant that they have implemented, that they've purchased. And so their goal is to process the meat from their bison herd through the meat processing and then use that to feed their kids at their school. So it becomes basically a whole tribal involvement in the school, in the school as well as with the students. So they're going back to eating traditional foods. And that's what control of the lunch program will give those tribes the ability to do. So they can incorporate more traditional foods, whether it's bison or blueberries or other things that are grown in the community. So it becomes basically a whole process of taking back some of the traditional ways of the tribal community, and then teaching that to the kids in their student lives, in their daily existence. I think also with the school lunch program during the summer, these kids often go without meals. The daily meals that they would get during the school system, they miss those during the summer. So I've been back to Sisseton, and I know what my cousins eat. They rely on snacks and non-nutritious foods, potato chips and other things that they get. And so having a food program that actually puts together a food bag or food lunch program for the kids to come to an after-school program or a summer school program where they actually get food that's a balanced meal, nutritious meal for those kids. So it's a mix of things where during the school program, during the year, they're actually fed more traditional foods. But during the summer, when they can do bag lunches for the kids to take or come to a summer program, they can get those foods as well. I think are the benefits to having tribal involvement with the USDA program that provides food for that community.
Well, I know it all comes back to health. When we can provide our kids with nutritious food, and again, food that they will eat, whether
Yes.
it's bison or in Alaska it might be salmon. It is important to make sure that we have those healthy food options there. I'm actually going to be meeting in just about an hour here with the nominee to be Secretary of Agriculture. I want to talk to her about programs like FDIPR and what more we can be doing, again, to making sure that we're getting some of our traditional foods into these menus again, so they're healthy and the kids will eat them. I'm going to give everybody a little bit of a homework assignment, only because I can, and that's not just for those of you that are part of our panel today. And Mr. Lewis, we haven't forgotten you there in Hawaii. But I mentioned the Alice Spotted Bear and Walter Soboleff Commission on the Native Children, and Chief Smith mentioned it as well. It is something that, again, as a committee, we're going to be looking at this report to really understand. The report has identified some of the systematic challenges that face our Native children, and what we want to do is now take some of the recommendations that are in the report, and I would like you to take a look at it. It's not that long. It's 80. There's a lot of index to it, so there is a summary, but I want you to go beyond this summary. I'd like you to take a look at that, and then within your portfolios, with it, whether it's education or finance or healthcare or housing or public safety, kind of provide us, if you will, some of the recommendations that you would like to see implemented from this to again, it's focusing on our Native children, but when our children do well, we all do well. And so I welcome your input as we develop kind of this broader package of initiatives focused on healthy Native children. And for those that are part of our listening audience, don't think that, again, we only want to hear from those that we have invited to testify today. There has been much discussion about the impact of the recent actions as the administration has been stood up, the freeze on many of these programs. Again, we've tried to make sure that it is clear that it should not impact our federal, our Indian, and our tribal programs. But in fact, we know that there are holdups. There are areas that we are seeing a spillover that should not be happening. And so we need to hear from you on that. I hear what my vice chair says, and I take it to heart, because I too believe that you don't have to petition the king. This is our responsibility here in the legislative branch to make sure that we are representing those that we serve. And when something is not within process, is not within the rule or the law, we need to be there to speak for you as well. And so the more that we can receive from you in terms of this portal is not opening, this funding source is not coming through, please let us know. We have an inbox on our website that welcomes these very specific initiatives. So let us try to make this a little bit easier. I know it has been hard. And the last point that I will make on this is is even though we may be able to release funds that have been delayed or halted, and we get those moving, we are seeing very clearly what is happening with a push to for a reduction in employees throughout federal service. Those are your programs. Those are programs that impact you. And so we can help you get the money released, but if there's nobody then to help execute these through the programs because they were either asked to leave or just decided that this was not the environment for them, then we're no further ahead. And so know that I take very, very carefully this as an issue, that it's not just about the funding for the programs. It is also about the ability to execute under the programs. We need to have these people in place, and for far too long within our tribal programs, we have had workforce shortages. We see it within our schools, we see it within the healthcare, we see it in all aspects. Certainly public safety, we hear over and over and over again. And so this is yet another challenge for us. Know that we take this up. We are here to listen, to learn, and to act. So thank you for working with us and with this committee. And with that, I thank everyone for your time this afternoon, and the committee stands adjourned.